Welcome to the Brain Saver podcast, where I teach you how to change your brain, protect your future, and be a part of the generation that is going to end Alzheimer's and dementia. Before we start every podcast, I have to let you know that you can protect your brain, you can reverse cognitive decline, and it is much simpler than it may seem. Now let's jump right into today's episode. Hello, everyone, and welcome back to another episode. I'm really glad to have you joining here today. I'm so glad that if you're new here, that you've found a tribe of people who are really willing to fight back against Alzheimer's and dementia and who want to protect their brain. Because it's important to find a community who wants to push you in the direction you want to go, especially for your health. Today's episode is going to be something very close to my heart that I don't talk about that all that often, but I need to start talking about a little bit more, because we don't really look at the science too much. I'm really not going to dive in too deeply into different scientific things, but this topic is very, very important. And it looks at you. It looks at me, especially if you are a caretaker or if you've or if you're the loved one of somebody who's dealt with dementia or Alzheimer's, or maybe you're dealing with it yourself. So we're going to talk about your experience, the burden it has on you, and the burden that this disease, dementia and Alzheimer's, has on almost the whole of society. We're going to talk about some numbers later on in the podcast. But because I'm covering my own experience and the experience that my dad has as the main caregiver and the toll this disease takes, I'm going to get a little bit more personal in this episode. So I hope you guys don't mind that. And it may trigger some emotion in you, especially if you've been out of that realm for a long time and now you're dealing with some memory issues or whatever it may be yourself. So be prepared to feel a little bit more if this is something that hits home for you, because I know that the impact this disease has is devastating. And if you're new to this podcast, again, my name is Tyler Bradley. I started this podcast to help change the standard of brain health care. I run my own brain health coaching company, and I'm working on creating the gold standard of brain health coaching to actually change outcomes for people that want to heal and protect their brain for the future. And I started doing this because my mom was diagnosed with dementia at only 57 years old. And so I'm really in the trenches trying to change how we operate in the brain health space. Today, what we're going to cover: one, the burden of money and the dementia actually takes on the caretaker, the family, and the world as is. The toll it takes on the patient in an unseen mental health crisis, and the toll it takes on the caregiver throughout that process. And then we're going to talk about my perspective on what can actually be done, whether you're preventing or working on reversal of this disease. Jumping right in, the burden that dementia takes that goes unnoticed many times, at least from what I see, whether it's a social burden, the toll on the standard medical industry, so like insurance and hospitals and things. Cleanliness in the household is also a big factor that might go unnoticed. But one of the biggest burdens is cost, the cost of the disease, the total amount of money that it takes on average for one singular patient, one singular family, is around $300,000 over a lifetime. This total covers insurance costs, neurology visits, testing and scans. Like, for example, my own mother had to get a PET scan and the insurance wouldn't cover it. And it was so much money to pay out of pocket, and they just didn't really do it, even though it was quote unquote required to diagnose, even though they didn't really need it to diagnose. So then they just didn't end up getting it, but other people might have to do that. And that's an out of pocket cost that might end up coming up for some people, driving that cost higher. Medications, caregiving, whether it's in home or out of home, and that out of home ultimately coming in at nursing home care, which can range dependent on the nursing home and where you live, like $5,000 to $10,000 to $15,000 a month, if not higher, maybe a little lower, depending on where you live. Much of this cost is pumped up higher because of the way that the insurance companies work and the way the system just kind of is burdened down by this, because insurance costs are kind of pumped up, likely just because of the way the system has functioned for years, with the insurance being able to charge kind of whatever they want, or the hospitals being able to charge because insurance is covering it. And so that might be pumping up the cost some, but either way, this $300,000 is still a massive cost on each and every family. Looking at even bigger outside of the family at society, the Leonard Schaefer Institute for Public Policy and Government Service at USC released the total cost of dementia burden calculated in US dollars in 2025. The number covers costs of things like medical care, quality of life loss, even things like lost earnings for care partners or for children who have to quit their jobs or take time off to take care of their family, which is something that goes unnoticed many times. And then some other care like nursing home care and informal care involved. This entire cost in the US alone at a full societal level, they calculated it at 781 billion. And I apologize just to let that number sink in. $781 billion. We're 3/4 of the way to $1 trillion in cost that dementia and Alzheimer's is causing just in the US alone. Just in the US alone. A quote from the article: the economic impact of dementia in the US is rising as the population ages. The impact goes beyond medical costs and includes hours of unpaid care by family and friends, earnings losses, and declines in quality of life, affecting the lives of persons living with dementia and their families. This economic loss, this economic burden is continuing to grow. It gets higher and higher. And not just because the cost of living is going up, but because more and more people are getting diagnosed with these diseases. It has increased steadily over the last 20 years and is projected to continue increasing. And so this new brain standard that I'm talking about, that I have for my podcast, and like why I named my podcast, this is, we need a new standard in order to make this number go down instead of up. The cost is not just on the loss of a family member over time, but if we look at it as an entire societal issue, so much time, so much effort, so much economic burden, and a deeper level is causing large scale problems. The medical system, neurology industry will not be able to keep up with these numbers and with the growing numbers of Alzheimer's and dementia patients. Then we can zoom in outside of the toll this disease takes economically on the individual and society as a whole, but we can zoom in on the person who develops it, the actual patient. People only ever really see, at least in my opinion, the effect that dementia has on someone, at least who is pretty far along. You don't typically see people talking about their experience early on and like the little things that pop up, the subtle forgetfulness, the subtle confusion. People typically only really see and talk about in stages. And if you want to learn why I think that's the case, go listen to podcast number 2 that I released a couple weeks ago, because it talks all about how I think that people fear talking about their brain. So I think that stigma is really important to understand. I'd go listen to podcast number 2, but most people hide it. They're scared to talk about it. They're embarrassed that this is happening to them because it's a disease. Some people hear the word disease and they think that they're dirty or there's something wrong with them, and there is, but you shouldn't feel embarrassed about it. Talking about it and taking those steps forward is the answer to the problems. So why do we have this stigma? And that stigma, I think, is a lot of times what creates a mental health crisis outside of the fact that people feel hopeless whenever they develop these diseases. What hardly gets seen, and I think that this is a lot of what my mom hides from me or hid from me a long time ago, is that the isolation that she likely felt. Her and my dad were going to the neurologist. They might have talked about it with their closest friends, but nobody really gets what the person who's diagnosed is going through. That nobody really understands that they feel hopeless, they feel isolated. They go to the doctor and there's only a few things that the doctor and the typical standard of care says that they can do because that's been the norm. And up until recently, the stigma has been, behind a diagnosis of like, it's a slow death sentence almost, where you lose yourself over years. And so, of course, it feels isolating. Like, could you imagine the loneliness that you'd feel, the despair, when that diagnosis comes up into your life? And if you're going through that, I feel for you, and I hope that you reach out to me, because there are more answers out there that you can work to take back control in your own brain. So please reach out to me if you are feeling like that and you want somebody to talk to. And honestly, I don't cry often when I think about her disease that she's developed, whether that's me just masking those emotions or not. But when I think about what was going through her head when that diagnosis came up in the years after, until she started getting worse to the point where she doesn't really understand as much of what's going on, that typically is what tips me over the edge, because I can't imagine what was going through her head. Many dementia patients also experience clinical depression, and in some studies, depression is cited in 30 to 40% of dementia and Alzheimer's cases. And that number was not clinically diagnosed depression, that's just reported depression. And that can go even higher if you look at cases of people that still have autonomy in their life, but are dealing with this disease. Maybe they're not reporting it, but they still feel those symptoms. They just don't know that those depressive symptoms are what they're really experiencing, because they can feel their future slipping away. Likely is why they're experiencing the issues. That isolation, that loneliness in the disease is likely why they're experiencing the issues. And your brain chemistry changes, which is a big reason why depression is such a crisis, in my opinion, when it comes to these diseases. Not only does the person lose hope as they're studying depression in their life, but we can also look at the caretaker and what the caretaker experiences, which is usually the husband or wife. In my case, I'm not the main caretaker. My dad is, but I help my father. So it could be you as the child being the caretaker, because many times dementia and Alzheimer's develops later in life and in their people in their late 70s, 80s. And so you as the child might have been the only person that could actually take care of your parent. And so that could have been you. Either way, there's a big toll that it takes on the caretaker. So as I look at my dad and even myself, there's frustration, there's worry, there's feeling like he feels like he's burdening those around him because of my mom's state, and I can tell that whenever he's interacting with people, feeling like he's burdening me when I help. And for myself, I get frustrated and then I feel bad about it because I know that she can't help it, but in the moment, that's just the nature of the disease. And then there's the, anxiety of wondering, what's going to happen months from now in the future. All of these are huge burdens on the caretaker, and the huge issues that roll up and take a toll. And outside of that, whenever you're feeling these things, that can also take a toll on your health, the caretaker's health. Some studies show that depression prevalence in caregivers is around 15%, but on a larger scale, when we look at meta-analysis of multiple studies together, it shows that depressive tendencies can occur in up to 50% of caretakers when you look at the broad spectrum of what could be considered depression or depressive tendencies. Not only we're looking at depression in caregivers, but loss of quality of life. From the Alzheimer's Association, and this is a quote from their website, an estimated 18.4 billion hours of unpaid help is given from caretakers. On average, this represents nearly 31 hours of care per caregiver per week, or 1,612 hours per caregiver per year, which is a lot of time. And that average, nearly 31 hours of care per caregiver per week, that's almost a full-time job. And especially as patients get into later stages of Alzheimer's and dementia, they need someone with them at all times. And that's why these nursing care facilities and memory care facilities are so important. And even then, I believe there is a lack of those, though I don't have the data on that. That is something I should have looked up because I just thought about it, but I don't have the data. But you can only assume that that is the case. If you've taken care of, or if you were taking care of someone else, you understand the detrimental effects that it has on your own health. You understand that caretaking on its face is taking time away from you and your ability to prioritize. It's taking all that time away from when you can make your own food, work out, deal with your own stress. And all of that combined takes a toll on your sleep, the fatigue, the burnout from frustration, and maybe fighting with that person, whether it's your significant other or your parent. And it's not just the day-to-day toll it takes for my dad, but he's even waking up in the middle of the night some nights, worried, thinking about what's coming next, worried about something that he said to her during the day when he was frustrated. And there's this unknown future that is constantly looming for the dementia patient. And it's enough to drive the caretaker crazy outside of what they're already dealing with, because every day is so different and you just don't know what's coming next, especially as patients start developing swings, and they have like an upswing where they're doing okay being the new baseline for okay, and they swing down and get worse than they've ever been the next week, which is a very common occurrence. And so you just don't know what's going on. The caretaker is burnt out from constantly fighting that battle, and there's all kinds of health issues that play into it. And if you're a caretaker or have been, you know exactly what I'm talking about. And this is the biggest reason why I help people who have been caretakers, children of dementia and Alzheimer's like myself, because I understand what you're going through. I understand the toll it takes, and that toll that it takes on you increases your risk further. And so that's why I decided to get into this and help people who have seen it firsthand take care of their own health. Now, all this is bad, the cost, the burden of the disease on the caretaker and on the patient, but what can actually be done? Because I can talk about cost, I can talk about burden all day, but what actually fixes the issue? Is there a fix to this issue long term? The obvious and overarching answer is a full overhaul of the system, whether it's the way that neurology clinics work, whether it's the way that insurance works when covering uh, neurology and brain health things and diagnostics and tests. That's mainly for the money side of things, but also the standard of care that is needed in order to prevent Alzheimer's and dementia needs to be changed. We need to be more focused on overall longevity and health, less on fat loss and over optimizing. We need to drop the amount of stress that is just so prevalent in the world. And those are kind of the big overarching themes. Bringing costs down is going to be beneficial for society as a whole, for families, and for access to the changes that need to be made. And so, on its face, we can be, more vague and overarching in that sense, but that's also very embedded in society. So that takes a full societal change in order to do. It's too difficult to break those chains, at least right now. So that leaves us with you and I to take action, the collective community of people who are watching this podcast and ready to make change. First things first, prevention is the number one factor. It is key. If the upcoming generations don't develop dementia, obviously that softens the burden. So this number that's continuing to slowly rise, we need it to start slowly coming back down, and prevention is going to do that. This does not have to come from a massive overhaul in your life. Brain health and preventing dementia and Alzheimer's is not overly complicated. And this is what I help all of my clients do in a very simple manner through diet, exercise, stress, and sleep. DESS, DES. You can think about that and optimizing those four things for your life, not overhauling. And that is going to completely change your prevention, completely change your brain for the future. And yes, the world around us makes it harder, but ultimately you make your decisions daily. Ultimately, you have control over those things at least 99% of the time. And so your decisions are powerful, and you have to make the decision now to go through diet, exercise, stress, and sleep and work on those things for you in prevention. Second, the standard of brain health medicine must shift. There's literally a clinical trial that just released at the beginning of this year, out now, showing that cognitive impairment can be reversed with the correct protocol. From Apollo Health and Dr. Del Bredesen, a clinical trial was done on 73 people who worked, and 50 of them worked with Apollo Health doctors. They worked within this RECODE protocol. They also had let me talk about the cost first. The total cost of this with only 73 people was $6 million for this clinical trial, which on its face, you're like, whoa, $6 million to run this clinical trial. Like, how can the average person go through this? But that comes out to around $82,000 per person in this study over a 6-month time frame. And they received doctor's visits, health coaches, nutritionists, personal trainers, food, supplementation. So they received a lot. That $82,000 per person is already by itself $200 and almost $220,000 cheaper or less than the average cost per family over the lifetime of dementia care. So already, this is so much more cost effective if we want to use that metric to measure what you should be doing and looking at as like, okay, the burden of this protocol is pretty heavy. It's a heavy lift to make happen, but comparatively to the alternative, I mean, it's a no-brainer. But then we can go even further and look at this $82,000. I just said cover doctor visits, health coaches, nutritionists, personal trainers, along with food and supplements, but you do not need all of those things. On its face, you likely do need a RECODE trained practitioner, RECODE trained doctor. And if you can implement everything that they run through your RECODE protocol on your own, fantastic. You only have to work with that doctor. The cost is going to be much lower. You're already going to be buying food anyway. You're just changing the food you're consuming. You're just changing your lifestyle and habits. And so on that base ground level, a lot of people can make it happen. Almost anybody can make that happen. And then if you want to take it a step further, hire a health coach. That's what I do. I'm a Recode certified health coach. And if you want to hire a health coach like me, it's going to add to the cost, sure, but it's going to streamline and speed up your actual results. Because what I do as a health coach is I help people pinpoint, okay, let's do this week. Okay, how did that go? It didn't work very well. How can we make it work better? So instead of it taking a month to complete something, a month to get really good at something, it takes 2 weeks. So we're just shortening the time frame with a health coach. And if you think of it like that, is the cost worth it? Likely. Yes, the cost is worth it, especially if you're having a hard time completing it yourself. So we have to change this new standard. This new standard is the standard. This precision medicine Recode protocol and things like Dr. Heather Sandison are doing are the new way forward. This is how we take control back from Alzheimer's and dementia and the growth that it's had over the last 20 to 50 years. For the burden to be lifted at a personal level and at a community level, we also need to have more conversations. We need to talk over, the stigma about brain health. We need to get over this fact that if we talk about brain health, it's taboo. If I talk about my memory problems or I talk about the brain fog and fatigue, that means that I do have brain problems and it's real and there's no hope after that. That's not the case. I am urging you to talk about your brain health. I'm urging you, if you've had a loved one that's dealt with it and you've seen the toll it takes, to talk about that. Release the emotional side of things when we talk about our own brains, and let's start looking at things analytically. Let's start looking at things with hope and with faith, because you can change your brain. I promise you that. And even I want to put the clinical trial on how they reversed cognitive decline in all 50 patients. By the way, every single person reversed their cognitive decline based on their biomarkers, their blood tests, and things like their MoCA assessments and their CQ assessments. And then the 23 people that they didn't put on the trial, it was just standard of medicine. They put them on it for the next 3 months following, and they all improved in the precision medicine, even after the 6 months of not doing precision medicine. Anyway, talking about your brain is so important at a personal level, community level. That's why I'm hosting an in-person brain health event tomorrow, I guess, from this podcast release. And so we need to have more conversations about it because it is so, so important. And with that, together we can work on ending dementia and Alzheimer's as a collective. Individually, we have a little bit of power. We can change our own outcomes, but together as a collective with our voices, changing the standard of care can happen and needs to happen. And the only way you can do it is by starting now. My favorite saying about when to start is the best time was yesterday. The next best time is today. And so I hope you start today. Thank you for listening. I hope that it lit a little bit of a fire inside of you, hearing those numbers to start working on yourself and start promoting brain health to other people. Let's start talking about it. And I hope that whether you've got brain issues with your brain on yourself, the parent or your parents had dementia and Alzheimer's, or you're somebody's spouse, that we can really open this up and take away the burden off of you and off of the world as a whole. This has been the Brain Standard Podcast, and I truly thank you for listening. I hope after listening to this episode, it might light a fire inside of you to really take charge and control of your brain's future. And if you found it useful, maybe share it with a friend, follow the podcast on whatever platform you're listening, and I'd really, really appreciate a 5-star review. And for more information, all you have to do is visit bradleyhealthcoaching.com. I have a couple of resources on there, or you can book a call with me and figure out how to take the next steps in taking care of your brain. Thanks so much again for listening, and I'll see you on the next episode.